Hi, VETgirl here. Well, VETgirls. I'm Dr. Amy Kaplan, and I'm a boarded small animal criticalist. I'm joined today by Amanda Shelby, RVT, VTS in anesthesia and analgesia.
And we're super excited to bring something new to you all in this VETflix series. We're going to highlight key clinical tips from VETgirl webinars that have happened over the last several months or so. And so if you've missed these webinars, we're going to talk about those key takeaways.
All right, so we're going to start with a webinar by Dr. Ozawa on reptile analgesia and sedation. Now, Amanda, I know that you moderated this webinar, so what were your thoughts and key takeaways from this one?
Yeah, we get to select to some degree, what webinars we get to moderate, and I was available. And of course, I'm passionate about anesthesia and analgesia, as most people know. And so some of my key takeaways from this webinar. Now, I have to be completely honest. I am not a subject matter expert when it comes to anesthesia and analgesia in reptiles. Those are on the periphery of my expertise. I've anesthetized them. I could probably pass a test. There was textbooks answers, but I don't have a lot of clinical. I wouldn't say I'm the expert. But I found it really an enjoyable lecture as a refresher for myself. And the key takeaways, and some of which might blow your mind, um, are really that reptiles are not the same. So snakes are not all the same. Lizards are not all the same. Turtles, tortoises, etc. That there's a lot of species variation. So in dogs and cats, we often say if a procedure's painful, we'll administer a full agonist opioid. But that doesn't apply across all of our reptiles. Uh, so the key bullet points that I found about analgesia in reptiles is that full mu agonists do show most promise for analgesia and most of our cloacians. I don't even know if I'm saying that correctly. So turtles,
Oh, Chelonians,
tortoises,
yep. That's a
chelonians.
tough word.
Uh, it is,
Yeah.
and it's not, again, not my scope. And lizards. Um, Medications like butorphanol and buprenorphine have not been shown to produce anti-nociception, so good analgesia, in those species and are generally considered inappropriate analgesics if you have a painful procedure. Interestingly, though, dexmedetomidine, so not an opioid, an alpha-2 agonist, should actually be considered as an analgesic for snakes. Um, because other analgesics have failed to produce thermal anti-nociception, so pain management from thermal sources. So, reptiles are complicated, and that's those are some of the key takeaways. There are definitely other things I think that are really important. It did branch into some analgesics, and of course, using chemicals to restrain, sedate, and anesthetize reptiles. Alfaxalone is usually the shining star for reptile sedation, brief anesthesia, brief sedation. But it's important to remember that that drug does not produce analgesia, and this talk was really focused on analgesia. And then, of course, the volume required might be cost limiting and just volume administration limiting in those larger reptile patients. So if I work with a reptile, I keep in mind that each species different, that they're well equipped to harm you with nails, claws, beaks, teeth, maybe teeth, tails that are whips. I don't know.
Yep.
Sharp
I've
objects
seen
on
a lot of
all
tail.
ends. Yes. And that you do a little bit of homework when you know you have one coming in so that you can appropriately select medications that are going to optimize that patient's experience.
Great. Yeah, no, I don't see much exotics these days anymore. But the next one is in my wheelhouse with cats and dogs, in particular dogs. So the next webinar that we're going to talk about is titled Quit Your Itching, Managing Pruritus and Frustrations with Canine Allergy by Dr. Brittany Lancelotti. Now, in this webinar, I thought it was really important to highlight that first, allergic dermatitis doesn't affect just the animal, right? It's going to affect the pet owners as well. And, I will see these patients in emergency because the clients are getting woken up at 2 in the morning from the sounds of that incessant chewing, the itching that just doesn't stop. And so these poor sleep deprived owners find their way to me in the ER because they're just so desperate to break this cycle. But, on ER, I'm really just doing a Band-Aid for them. So, depending on how that dog's skin is looking, I'm going to be treating what I see, maybe adding in some steroids if we really need to, suppress that flare up so that those poor owners can go home and get some sleep that night. But then I'm sending them on to their primary care veterinarian to do the real work, which is managing the food trials and trialing all those allergy medications, maybe some allergy shots. And this isn't a quick fix. These things take time to get under control. And then it truly is a lifelong condition for that pet and for everybody that is involved in that pet's care. But another thing that I found particularly interesting in this lecture was that, well, it's interesting to me mostly because I have my own puppy that just looks and smells like a food allergy is on the horizon for him. It's that the discomfort that these pruritic patients experience, they can cause some additional behavior changes that we should all be aware of. So they may show a heightened sense of fear, anxiety, aggression, and they might even be less responsive to training because, I mean, I'm projecting here, but likely it's because they're just constantly uncomfortable. So I thought that that was really interesting and something for us to keep in mind as clinicians that sometimes these behavior changes that we're seeing could actually be related to a little bit different of an underlying problem that we need to investigate.
Yeah, definitely not an area that overlaps a lot with my area of expertise, being in anesthesia and analgesia. But I agree, one of those key elements that was particularly interesting was that dogs with allergic dermatitis do exhibit additional behavioral challenges. So increased fear, anxiety, stress, etc., touch sensitivity, and that, we can really empower that pet owner to be aware of the lifelong and long road to getting this under control for these patients, but we can also be a patient advocate and getting ahead of that if we know that these patients have that issue with maybe some medications that help increase their level of comfort in visiting us. So my only other guilty confession in being able to relate is that I have a boxer and I have a prerequisite to be in my house. And for me to love you as my pet, you have to have Frito smelling feet. And so I'm definitely on, my pets are probably on that spectrum of atopic dermatitis coming my way at some point and could likely benefit from having that dermatologist. So very interesting webinar. But next up, I'm gonna ask you about one that we launched in December of 2024. It was a small animal webinar on vaccine-associated sarcoma, myth or reality, by Dr. Philip Bergman, and he's a diplomat in internal medicine with a specialty in oncology. So maybe quickly, if you don't mind, I want to share a quick recent
Yeah, go
story.
for it.
So we had a bat in our basement,
Uh-oh.
and yeah, yeah. And so, I don't think any of our pets got down there to interact with the bat, but it was definitely neurologic, like flopping around before it passed away. And we just, we actually submitted it to the state for testing. But, I did I panicked. I'm like, well, I'm vaccinated, so maybe I'm fine. But nobody touched it. But anyways, I rushed the cats specifically off to get boosted. And this, maybe highlighting my ignorance or age in practice here. Um, back in the day, we learned to vaccinate in the scruff of necks, and now we don't do that, which this webinar highlights some. But they offered me two different options for rabies vaccines, and I want you to maybe highlight. I didn't even know there were multiple options for rabies vaccines. I've never personally, professionally administered a vaccine because I went straight into anesthesia and analgesia. So, what would be your key takeaways from this webinar, especially speaking to someone who perhaps doesn't have access or, maybe older information when it comes to how we vaccinate and what vaccines are available to us?
Well, I have to admit it's been a hot minute since I've given a vaccine as a criticalist. We're not really in the business of, that preventative care, but I have worked in day practice eons ago, and I just wanted to say that back when I really dislike having to give vaccines because it was really difficult for me to give them anywhere but in the scruff, especially in a cat that doesn't want to be restrained and then get poked with a needle. But yeah, I did want to say that I feel like, we've heard about this risk for vaccine-associated sarcomas for some time, which that, has kind of driven our practice of trying to vaccinate on the distal limbs so that if a tumor should happen to form, you've got that option of being able to take off the limb as opposed to the tumor growing on the trunk of the body, which, that's not really a great area to try to surgically resect. But so as a criticalist that doesn't get vaccines, the main takeaway that I got from this webinar was that they found that the risk of vaccine-associated sarcomas was a lot higher in the vaccines that are the adjuvanted vaccines. And so just a generic recommendation to, keep an eye out for which vaccines you're administering, and then we should always try to vaccinate as far down on the limb as we can.
Yeah, yeah, definitely. And I learned that firsthand with a rabies exposure. Which the bat was negative. Like if
Oh,
everybody's on,
good.
yeah, the bat came back
Gosh.
negative, but everybody's boosted. And then the dogs had recently gotten their vaccines, honestly, just a few weeks prior to that event, so they were just in quarantine. So, anyways, where everybody's fine. But
Quite a scare.
yeah, moving forward to another small animal webinar, diagnostic essentials for the vomiting dog. I can imagine as a criticalist, you have worked with a lot of vomiting dogs. So Dr.
Oh,
Holly
yeah.
Brown and Diane Wilson gave this lecture for us.
Yeah, so this was a great lecture. And yeah, like you said, in ER, we see a ton of vomiting. I can comfortably say that we see this complaint every single day in my hospital. But now the causes of vomiting are like pages long, right? So part of the job is having to strategically select your diagnostics based on what that patient is presenting like. So what do you think is most likely the cause of the vomiting and kind of whittle down from there? Because there isn't just one test for vomiting, right? There's multiple tests. They all have their own unique value. So usually I'd say blood work is kind of like the first tier test to show us how liver and kidneys are feeling, and then a CBC can show us if there's significant inflammation going on. When it comes to imaging, though, I found this interesting that a lot of times people ask me, like, why don't we just jump right to doing an ultrasound? Why are we doing things like X-rays? But Dr. Brown and Dr. Wilson, they explained it really well that X-rays give you a more like a broader survey of the GI tract, whereas ultrasound is perhaps better used to like hone in on the abnormalities that you're seeing on the X-ray. So if I saw a rounded liver lobe, or if I've got the dog in left lateral view and I could see that there is something in the pylorus, then ultrasound might be able to help kind of corroborate those findings and tell us whether or not we need to be super worried about them. And today we also have this option for AI readers for X-rays. The technology is still pretty young in its capabilities for detection, so I just bear that in mind when we're deciding where that can fit into the workflow at this stage.
And I just want to highlight, now this wasn't a webinar, but VetGirl on the Run podcasts are well known, but you summarized a publication, I believe it was well, I have it here. The effects of antiemetic therapy on time to definitive care in dogs and cats. And this webinar really made me reflect on that podcast where you summarized that publication that you released in February of 2025. And
Yeah.
maybe you could just like highlight, I thought those were really fascinating results. And maybe those results, our audience might actually benefit from hearing a little snippet of that
Yeah,
podcast.
sure. Yeah, no, that was a great podcast. So I'm really glad to see with this paper that somebody looked at whether us giving an anti-nausea medication resulted both in a longer delay for that patient getting surgical intervention or endoscopy to take out that foreign body, but also did the patients that get an antiemetic, did they have any bad consequences? Like, was their GI necrosis by the time they got to surgery? Did it relate to any kind of surgical complication? And what they found was that from the time a patient was first seen by their vet for a problem, now keep in mind the pet had been variably sick before coming in to see the vet. So maybe it was a couple hours in some, a couple of days in others. But from the time they saw their vet, they were either given an antiemetic or, an investigation was done to look for whether they needed to go to surgery. And so what they found is that the patients that got an antiemetic, they did have a longer gap between that first visit and when they got to surgery. But what was a bit more interesting to me is that that didn't translate to patients having surgical complications. So
Mm.
the anti-nausea medicine did not actually translate to those patients having any surgical complications. What they found was the whole overall duration of time that that pet was sick, again, from before they saw their vet to when they finally got to the ER, that's what actually correlated more to surgical complications like the GI necrosis. So
Yeah.
super great paper. I'm really glad that somebody published that because as somebody that prescribes anti-nausea medications
Yeah.
on pretty much every single shift, I'm just
Yeah.
really glad to have some support behind me now.
Yeah, and obviously I administer a lot of those being a technician following your prescriptions. So, yeah, that I thought
Awesome.
that was just really helpful clinically. So glad that we
Yeah,
have webinars around that, but then also that podcast.
great.
I think we're going to switch gears and talk about one of my talks. Yeah.
Yeah. Yeah. So next up is Amanda Shelby's webinar from January 16th on solutions to dilution, solving medical math. Now, I just want to say that Amanda here is the one that actually taught me medical math in vet school, so I was pretty excited to see that she's teaching it here. So, Amanda, can you give us some of your own personal highlights from your webinar?
Yeah, definitely. I think for me, the key takeaways from that particular webinar are that it's okay if we do math differently. What I shared with that webinar isn't necessarily how I even prefer to do math if I have all the bells and whistles and toys. I'm talking about syringe pumps. Um, in my hospital and fluid pumps, but I really wanted to empower the individual that you can do math how you understand how to do math as long as it's mathematically sound, which is saying math a lot in the same sentence. But if it's okay to be different, as long as we all arrive to a correct answer at the end. Okay, so that would be the first key takeaway. The second one is have some humility in real world. You're gonna make mistakes.
Hmm.
It's possible, I function in a very high stress dynamic situation where I only do emergency on call for anesthesia. So mistakes are likely to happen when you have multiple people talking to you, you're getting history while you're calculating things, your speed is important and obviously depending on the case, etc. So have some humility, ask someone to check your work. Even, I mean, I do math all the time and I'm very confident and competent in math, but still having someone check your math, write it out,
I
cross
always have
cancel
somebody checking my
units.
math, always.
Yeah. Yeah, it's just not worth making a huge
Mhm.
mistake that could be
Yep.
detrimental to a patient. It's just that simple. So have some humility. I will say that if your units cross cancel, so you write things out and your units cross cancel, generally that means your math's correct. That just that leaves. So I have size 7 hands, so big fingers, fat fingers. Not that everybody who's size 7, but my I have large hands. I think for a woman. And so sometimes my fingers might hit two buttons on the calculator. Sometimes the mistake happens there. But generally, if you cross cancel your units, the math will be correct. So those are the key takeaways. Perhaps the specifics for the webinar that people might really dive into and want to know is some simple things like percent concentrations. Really, like lidocaine comes at 2%. You just move the decimal place one place to the right to convert it to mgs per mil. So 2% is now 20 mgs per mil. So simple tricks like that. I share some of that. Of course, I love that C1V1 equals C2V2 equation, but consistency is key there. You have to make sure the units are the same on either side of the equal sign. So if you're working in milligrams per milliliter for one concentration, guess what? C2 is going to be milligrams per milliliter. Same thing with if your volume is solving for liters, then V2 volume is liters. So just making sure that's well balanced. And then I highlight how to do a CRI, a constant rate infusion, when you don't have a syringe pump using your patient's fluid bag. So should you find yourself wanting to do some provide analgesia or another drug, it doesn't have to be an analgesic, to a patient and you don't have all the fancy tools, it can be done. And if you check out that webinar, it tells you how to do it.
That's great. Thank you. Yeah, I have to say we have all these great veterinary calculators out there these days, but it's happened in my own hospital a couple of times that the power has gone out or the internet's gone out and they can't access those calculators. So, the calculators are a bit of a pet peeve of mine because I feel like with this math, if you don't use it, you lose it.
Yeah.
And so when you actually need to know how to do that math, if you haven't been practicing it because you're relying on a calculator, well, then what are we going to do? Then you got to go searching for a book and figure it out from there.
Yeah.
So, yeah, do you have any thoughts on that?
Yeah, I definitely struggle too with the calculators can be handy. Definitely with the electronic medical charts, you type in a patient's weight and it just spits out all the
Yep,
drugs
and
that have
they're
been
quick.
yeah,
Yep.
like they definitely are helpful and quick, but I agree. Practice makes perfect. Practice keeps that muscle shapely, I guess you could say, for lack of better words. So it keeps it sharp. And And we even have our wheels that help shorten the time it takes to calculate dextrose or a dexmedetomidine dose, or, our epi and atropine CPR wheel, RER calculator. But practice makes perfect, and I would definitely strive to practice when time allows so that you know how to do it. And that increases your comfort level with math, right? Um, yeah, so I don't know. Cross cancel those dang units, write it out, do it longhand. I'm in favor of practicing it as well. Yeah,
Great.
definitely.
Awesome. All right, we're going to shift gears for one more here. We are now looking at dentistry. So, Dr. Michael Balk, a boarded veterinary dentist, gave a webinar on February 5th called Pediatric Dental Disorders.
Yeah, I moderated this webinar too, and I selected because I have a puppy, my first puppy I've ever gotten as an adult, that actually has a dental disorder. So I was like, I need to learn more about this. So it was a super awesome webinar. It outlined specific pediatric concerns. It really empowered the whole veterinary team to pay attention and evaluate patients throughout their life cycle and courses, obviously following these pediatric concerns, but reiterating to clients the importance of looking for things and speaking to clients about pet health can really have an impact on the patient's life throughout their life cycles. And another webinar that one of the technicians did, Stephanie Perry of ETS and Dentistry, was also complementary to this. And now we're not going to be exploring it specifically in this VETflix episode, maybe in a subsequent one. Um, but she describes dental charting. And so, again, this is like a whole team benefit. And that's what really highlighted a whole team. It's an area of vet medicine that really can utilize the whole team. I think that's what I wanted to say. I struggled to find the words there. So I think that that's important, especially when you get a huge litter of puppies and everybody's like frantically moving around. You can definitely, as a technician, help the veterinarian learn what to look for in these pediatric patients by listening to Dr. Bulk's webinar. So, what were your key takeaways?
Yeah, I mean, I know that it can be a tough sell sometimes to have that conversation about really routine dental care with our young patients, but Dr. Balk really did help to kind of explain some of the things that could go wrong if we don't catch them early enough. So things that I see pretty commonly in the ER would be retained deciduous teeth, and we're just kind of like, retained deciduous tooth, whatever. But he did mention that these retained deciduous teeth really should get pulled as soon as that adult tooth is just starting to erupt, because they can cause some pretty significant problems as that animal is growing and the mouth is trying to fill in with all the rest of their teeth. Another thing he mentioned was that malocclusions of the jaw, they can actually cause trauma, such as like a tooth, abrading the occlusal gum surface and cause a lot of trouble eating and pain associated with that. And then also of note in our brachycephalics, they're actually prone to having that like overcrowding of the maxillary teeth, and so that can result in pretty severe periodontal disease. And so those actually, as you're seeing that overcrowding happening, those really should get pulled or extracted early in life to help give room for the teeth that need to be there. So those are just some of the highlights, but there's much more to learn from that webinar. So I'd recommend everybody just go check it out for the specific diseases that he covers there.
Yeah. So if you missed these webinars, Elite members do have access to view all of the webinars in our on-demand library at any time. Earn RACE Approved CE following a short quiz completion. But Dr. Kaplan, what do I do if I'm not an Elite member?
Well, great question, Amanda. Everybody can take advantage of our unique 14-day, no commitment, elite free trial that allows you full learning access to the entire site.
Outstanding. Sounds like a great option to give our site a go and catch up on everything that you might have missed. Of course, we didn't cover every webinar in the last few months, so please check out vetgirlontherun.com.
And until our next quarterly VetFlix episode, we hope that you found these takeaways helpful, and we look forward to seeing you at the next VetGirl event.